there is one concept that is called as a spare receptors. Some tissues have more receptors than which are necessary to produce maximal response, and therefore they are able to show the activity when all the receptors are blocked by the antagonist. So they are dependent on tissue, then they will be dependent on the measure of response and intrinsic efficacy of the drug. Now it was actually observed that when some receptors were completely blocked, still some receptors or some places in some tissues there was effect, and then when it was studied, it was found that some additional receptor check again. Saba, presentation, you please go through, everybody, presentation should be visible. Click on presentation. Is it visible? So in that cases, there are some tissues which are having these pair receptors. So it was found that when antagonist given in high concentration, so that all the receptor will be blocked till Saba, you click again on presentation. And this is very important concept to explain the mechanism, explain the reason behind why some of the drugs can act despite their all receptors are occupied by antagonist, and that helps in certain situations where these additional receptors or these pair receptors are there. As such, they do not participate in day-to-day or routine activities because they are more than number, and they only participate when the other receptors are blocked or completely blocked, and because of this reason they are called as a spare receptor. So this is one concept that is called as a spare receptors. Then next is some receptors are in active state. Yes, ACH spare plate found at motor end plate, correct. So there are certain receptors which are present in active and inactive form, and active states they are only able to initiate the cell signaling. For any cell there is an equilibrium between active and inactive states, and the inactive state usually predominant, and each state has its own affinity. Now there are many concepts behind this, that there can be drugs which are acting as a non-competitive antagonist, which are binding to receptor and keep it in inactive state. You are getting this concept? If anything which binds to receptor and keeps in inactive state, it is not allowing to go in active state. So if it doesn't go to active state, then either ligand will not be binding or agonist will not be binding, and because of that the activity will not be there. Okay. So this also important, this is also important. Wherever this inactive states are there, there is one concept about this antagonism. Then this any factor which affects in transition from active to inactive or inactive to active will play important role. Each state has its own affinity. So as I told you that some drug act during its active states, mostly agonist, but some antagonists may have affinity toward inactive state, and therefore they will retain it in an inactive state, and they are non-competitive. We will define this again for a clear explanation, and that will help you to understand throughout. Okay. Then next is antagonism. We have two types of antagonism. Okay. Basically competitive, non-competitive. Now for each we can have two views again. It can be reversible or it can be irreversible. In case of competitive also it can be reversible, irreversible, and in case of non-competitive also it can be reversible, irreversible. Now competitive means where the agonist and antagonist compete for the same receptor. Okay, they act on same receptor, they have similar structural domains which are responsible for binding the site, and therefore they compete for same receptor site. Particularly if it is active state, then both compete for active state. Okay. Now in this if there are two types, these are what? Equilibrium, non-equilibrium, or reversible, irreversible. Now equilibrium means we have seen earlier that there is equilibrium exists between the concentration of agonist and antagonist. The concentration of agonist is more, then agonist activities can be seen. If concentration of antagonist is more, then antagonism will be more predominant. Okay. As the concentration of agonist will increase, it will displace antagonist, and then complete action will be seen. So therefore we call it as a, no, this has nothing to do with up and down regulation. Okay. This inhibition is or antagonism is competitive, means it is equilibrium, that is the reversible, that means if the antagonist is if we increase the concentration of agonist, then it will reverse the antagonist effect, that is blockade. Okay, therefore we call it as a reversible. Why this happen? Why this happen? This happens because the bonding between receptor and ligand. Ligand here means it can be agonist, it can be antagonist. So binding between ligand and this will have very binding with the weaker forces, like we call as a hydrostatic or van der Waals forces. Okay, in chemistry you might have learned about it. So they are weak bonds or just electrochemical attachment it is there, so it can be easily displaced. However, when we call it as a non-equilibrium, it is irreversible. And why it is irreversible? Because the binding, particularly this antagonist, can bind it covalently or with stronger forces, and or they can modify the structure of the receptor. Okay, and because of that these things, that is it becomes the problem. Then in non-competitive also there can be some reversible, some irreversible. However, they are not based on equilibrium or non-equilibrium. Only thing is, if binding is covalent, as we have seen, it can cause permanent bonding and there won't be any change in the activity. However, maybe after some time, if the antagonist is removed and can be metabolized, then the receptor can available for again activity. So like that there are these combinations. competitive, reversible, competitive, irreversible, non-competitive, reversible, non-competitive, irreversible. Mind well, the non-competitive, reversible, irreversible, when we think, it doesn't mean that it is same as it is competing with agonist. Only reversible, non-reversible, it means that the bonding is either weak or strong. So agonist concentration is not going to make much impact on non-competitive. Okay, only thing is its own, if the antagonist come out, then it can make the structure again in similar manner. So this is how we classify antagonist. This is very important, because in throughout your course you will have these two words, or there are many drugs which are acting as a antagonist by any of this method. Okay. So I discuss about it. Action of the agonist is blocked if the concentration of antagonist is increased, or antagonism can be overcome, that is, antagonism can be removed by increasing the concentration of antagonist. Therefore we call it as a equilibrium or reversible. Here one word is used, that is also used in a sometimes somebody can ask you, this is called as surmountable. Overcome means surmount. Okay, so antagonism can be surmounted by agonist, so it is also called as a surmountable, and the irreversible is also called as a non-surmountable. So this is additional words which are there. Somebody can ask you about what do you mean by surmountable or non-surmountable. So it is not anything different, it is same thing. It is a reversible competitive antagonism, we call it as a surmountable. Okay, so this is very important, you should understand this. So agonist can produce maximum response in a higher concentration. Competitive antagonists shift the log dose response curve of agonist to the right, and EC50 of agonist will increase in presence of antagonist. There are many such examples like acetylcholine, atropine, adrenaline, propranolol, morphine, naloxone, etc. Let us see what happens. So when agonist alone was there, now same dose, if it is a reversible, okay, if same dose is there, then with small concentration of antagonist, you can see the pink line that is shifted. That means you require higher dose, which may be almost double dose, to produce the same effect. Okay, there is one definition that is called as a Pa2 value of antagonist. Okay, Pa2 value means it is the concentration or the dose of antagonist which is required or which is causing the administration of double dose, twice of the agonist dose, to produce same effect as earlier. So that is called as a Pa2 value. It is somewhat constant for antagonist, and this Pa2 value is important in many cases. It gives idea how much antagonism it causes. Okay, so this is pink line is antagonist, it has shifted, it has caused increase in the dose of agonist. Then if we will see the agonist dose here, log dose here, it means dose of the x axis, the dose is there, that means it is the dose of only agonist. And in pink line and in green line you can see that the antagonist was added in small concentration, antagonist was added with some higher concentration. So as we increase the antagonist concentration, no efficacy, potency that way you can say is decrease. Potency is a inherent, these see both are the inherent properties of a given agonist. Okay, Ajit. So they are again their constants. Only thing is because of because of that you need to increase the dose, because we have to reverse the effect of antagonist. Okay, because we cannot calculate potency in presence of antagonist. Again, I told you just now that every antagonist have its own Pa2 value. So does it mean that the agonist affinity is changing in every time, or in potency is changing every time? We have seen that the binding capacity of agonist is related with the potency, and the intrinsic activity with the efficacy. So efficacy will not be affected, because the agonist have its inherent property. Now depending on the antagonist, what kind of antagonist it is, it will alter, it will modify the receptor in such a way that it can cause the changes. Okay. Now next in this is this. So here see, efficacy has not changed, but that way if you say that in your don't use this, but you can see that we have to increase the dose, that means potency has reduced. Okay, but actually it is not reduction of potency, it is what, that to displace antagonist you need more and more agonist. Okay, more agonist is there, so more people are there, so which can pull out the antagonist and they will sit on the receptor. So this is how these are acting. Then irreversible antagonist, they bind to receptor with covalent bond. I told you just now, it is a irreversible blocking. They shift the drug response curve to the right and decreases the maximum response also, because the receptor are permanently bound, and because the receptors are permanently bound, the receptors are not available until and unless there is a presence of some spare receptor. The effect will not be seen, or if maximum receptor are blocked, then whatsoever effect of agonist you are able to see is because of what, spare receptors. Okay, so this is why you will see that there is a change in the maximum activity also. Then non-competitive, they bind the other site of receptor. Okay, and initially the DRC will be flattened, maximum response is reduced. Example, verapamil is a drug which can do, it is a calcium channel blocker. So how it happens? See, when agonist was alone, then the blue line was there, the maximum. See, you should able to understand these curves, they are very very important. From that you should able to describe everything, what has happened. The agonist alone was there, so it was having good potency, good efficacy. Okay, that means it was resulting into maximal effect, we call, that is efficacy means maximal effect, and at lower doses. Because of the antagonist which has caused irreversible blockade, it is not allowed, because some of the receptor which are permanently occupied, since the receptor are permanently occupied, this receptor, these are the receptor on which agonist will not able to bind. If the agonist will not able to bind on the receptor, then what will happen is that much receptor are not of any use for the agonist, and if the agonist cannot sit on this receptor, cannot go for this receptor, then no effect will be seen, and therefore it is decreasing if the effect, the total effect or maximal effect. So maximal effect will not be seen when it is a non-surmountable or irreversible type of reaction or antagonism. Okay, if you add more antagonists, there may be time come. Now, as I told you, spare receptor earlier, by this mechanism only it is understood that suppose all the receptor are blocked and still here more in the this yellowish line, you can see that more antagonist was added, but still there is small effect is seen. Why there is a small effect? The effect is maybe because of spare receptor in that cases. Okay, so this is how the these agonists are doing. These are the graphs we have seen. Here only figures are added. Dose response, doses of agonist, response is there from what's your measurable quantity, and these are the other effect we have seen. Okay. Then allosteric antagonist. What happens with the allosteric, or we can call them as a non-competitive. See now, the green colored one is agonist, red color is antagonist. Now we see that when we say competitive, that means both are binding on same place where the green is binding, they have similar structure. Okay, but if it is binding the nearby side, then and causes alteration, how it is altering we shall see. Okay, so these are the receptor. This is the normally what agonists do. Agonist fits into the receptor because of the structure activity relationship, and it causes action. Now what this antagonist will do? This antagonist, it binds, see it has reduced the receptor size because of the binding. The receptor has modified. Now agonist will not able to sit into it. Okay, so this is how it is acting, and because of this action we call it as a, or we can also call it as a non-competitive, because receptor and antagonist, they are not competing with each other. Okay, this is how we understood this various activities. So this is same graph for allosteric antagonist. If this antagonist are displaced, then we'll call, or this non-competitive, if they are displaced, then they will cause a shift in the curve, just like we have seen earlier. So as the concentration of antagonist increases, it will require more and more dose of agonist, and the second kind of allosteric antagonist, which are irreversible, or second type of competitive antagonist, which are of this irreversible type, they will permanently modify the receptor structure and will not allow the drug to bind to it, or agonist to bind to it. So this was only small portion which was remaining. Here we finished the important concepts of spare receptor, active and inactive receptor, and various types of antagonists, so that this helps